Welcome once again to our NCD Innovation Series, the non-communicable diseases. Just to remind you, these are diseases which are not transmitted from one person to another, unlike infectious diseases. Today, I would like to talk about a topic that is very dear to my heart, but also to most of you. This is a topic which is often neglected as part of non-communicable diseases. And this is actually called injuries and trauma. So whenever you get bodily harm that is not in line with your physiological workings, that is commonly called an injury. And an injury can be intentional or non-intentional. Intentional injuries are often afflicted by other individuals on one. These are assaults where a thief comes to your house and actually beats you and you end up getting a wound. You quarrel with your friend and he beats up and you end being hurt. The non-intentional injuries are usually what we call accidents. And each one of you has probably seen one person with an accident. It is very prevalent. You remember I told you about the other non-communicable diseases. It is estimated that about 18%, that's 1 in 5 people between 15 and 45 years actually get an injury every year. So that's very, very common. It means that whenever you see 5 people moving, one is very susceptible to developing that injury. The commonest cause of injuries, which is well known to us, are road traffic accidents. And this is not very far from us. You remember the series of injuries that have occurred over the last few months or even weeks. You can't run away from the fact that we had a bus where we lost up to 17 children. These were toddlers traveling, going for a trip, but because of a series of poor plannings, we lost up to 17 children. This could be your child, a relative, and it's very sad that all these injuries could have been avoided. I'd like to observe a moment of silence for those we lost through these injuries. May their souls rest in eternal peace. But on a positive note, most of these injuries could be avoided, including the accidental injuries. We have a lot of rules that could help us to avoid these injuries. The commonest injuries we see actually, we as doctors, I sometimes work in Mulago hospitals and we see the commonest injuries are actually from borders. If you went to what we call the emergency unit, most of you call it the casualty unit, it is hardly 30 minutes before someone comes. They were involved in a road traffic accident, either as a passenger, as a rider, or a pedestrian. And these road injuries can actually be very problematic because once you get injured, you get disoriented. They bring people to us who have had open head injuries. They have no relative, they have no what. And actually, these road injuries lead to death. But even if you don't die, these road injuries can lead to what we call disability. We've seen people lose their legs. We've seen people lose their memory. We've had, in fact, there is a common story of where we had a doctor who actually lost his memory and he could no longer practice just because he got involved in a road traffic accident. And the problem is that we don't follow the rules. When we have a walkway, the border are passing the other side. Even when you try to beam at them, they can actually slap your mirror. We've lost all means of humanity because we don't follow the rules. The cars have licenses, but we renew these licenses without checking them. We overtake at any one time. And of course, when you're a driver, in fact, I'm one of the drivers, but you are told that you are actually driving 3 cars. The car you are in, the car in front of you, and the car behind you, perhaps even 4, even the one which is coming the opposite side. If we deliberately take action and ensure that we think about our safety as well as the safety of the other, we could actually reduce these injuries. There are other forms of injuries which are afflicted in the homes. For instance, where you store After you go planting, where do you store those things you've used? The knives, how do you keep them? Those who have arms, the guns, how do we use them? These are the things that inflict injury. When you are cooking at home, how far is the kitchen from the rest of the other environment? Burns are a very common problem. In fact, this reminds me, we have a young man who actually got burnt. He got 50% burns, and we actually had to amputate him. He lost his limb, he lost his arm, then he lost another arm, now he has one leg. So this is all because he got burns. The other one, which is actually very important, is what we call electric burns. Sometimes those live wires, if we don't look after them very well, we can actually end up getting these injuries. The other common risk is actually falls. As you are walking, you have to be very careful in the environment we walk in. And this calls a lot of us. We have a responsibility as citizens, but we have a responsibility also as road users. We also have a responsibility as parents to ensure that our children are well organized in a protected environment. When you go to a sports field, ensure that there are no sharp instruments. When you get a sharp instrument which injures you, you should also make sure that you get first aid. A lot of people have gotten injuries and they don't care about them, only to end up getting tetanus. So whenever you get a cut, whenever you get something sharp cutting you, you should ensure that you go for vaccination for tetanus. And also, we should also make sure that as we live in our communities, we get things that protect us from injuries. We won't talk about traffic, that's a different area, but you also ensure that at least whenever you can, you put on shoes to avoid these common injuries. For people who are older, the greatest problem is actually what we call falls. Many Ugandans have not understood falls, but as a person gets older, their mobility becomes less, and once they fall, they can actually end up in a lot of trouble, and this ends them up in hospital, and they might actually die from these injuries. So as we continue to discuss non-communicable diseases, please make sure that in your thought process and as you plan, you try to minimize injuries to yourself, injuries to others, by ensuring that we follow the etiquette. If you are on the road, use the road properly. If you are in a class, make sure that your neighbor does not stumble on that brick that is there. Pick it up and take it to another. These simple things can actually reduce injuries between us and our friends. If you feel that this message is important to you or to someone you love, please go ahead and share it. And in so doing, you might actually save a life. Thank you very much.